Pain specifically in the left side of the middle back is one of those problems that is easy to dismiss as a pulled muscle, but it is rarely that simple. The middle back, also called the thoracic spine, sits between the base of your neck and the bottom of your rib cage. When pain is isolated to the left side of this region, it is pointing to something specific. In this video, I am going to walk you through every major cause of left-sided middle back pain, how to tell which one applies to you, and the exact steps to fix it. Causes of left side middle back pain. Number 1. Left-sided thoracic muscle strain. The muscles running along the left side of the thoracic spine, including the left erector, spinae, left rhomboid, and left trapezius, can become strained or go into spasm from repetitive movement, lifting, prolonged sitting, or sudden awkward twisting. This is the most common cause of left-sided middle back pain by far. The pain is typically sharp or aching, sits firmly on the left side, and changes with movement worse when twisting the torso, reaching overhead, or sitting for long periods. It usually improves with rest and gentle warmth, and worsens with sustained activity or maintaining one position for too long, such as driving or working at a desk. Number 2. Thoracic joint dysfunction. The thoracic spine has small facet joints connecting each vertebra to the ones above and below it. When one of these joints on the left side becomes locked, inflamed, or irritated, from poor posture, repetitive strain, or a sudden movement like reaching for something behind you, it creates a localized, sharp pain on the left side of the middle back. This pain often has a specific point of tenderness when pressed and frequently causes a catching or pinching sensation when breathing deeply, coughing, or rotating the torso to the right. Unlike a general muscle ache, this type of pain is often very precisely located to one spot. Number 3. Left kidney irritation. The left kidney sits at roughly the level of the mid-back, just beneath the left side of the rib cage and close to the spine. Any irritation of the left kidney from a kidney stone, infection, or simple dehydration creates a deep aching pain in the left flank and left middle back that is easily mistaken for a muscular problem. The key difference is that kidney pain does not change with posture or movement. If your mid-back pain on the left stays constant, regardless of how you sit, stand, or move, and especially if you notice any changes in urination such as burning, frequency, or unusual color, your kidney needs to be evaluated by a doctor. Number 4. Left rib dysfunction. Each rib connects to the thoracic spine at the back through small joints and wraps around to connect to either the breastbone or surrounding cartilage at the front. When one of the left-sided rib joints becomes restricted or inflamed, which can happen from a sudden twist, a forceful cough, lifting something awkwardly, or even sleeping in an unusual position, it creates a sharp, localized pain on the left side of the middle back that is noticeably worse. When breathing deeply, sneezing, laughing, or rotating the torso, people often describe this as feeling like something is out of place or stuck in the back. This is very common, often comes on suddenly, and is very treatable once identified. Number 5. Poor posture and muscle imbalance. Most people have a dominant side that they use more heavily in daily tasks, carrying bags, reaching for objects, or even how they sit at a desk relative to their monitor. If you consistently reach, carry, or work more from the left side, or if you sit rotated or leaning toward one direction for hours daily, the left side of the thoracic spine becomes chronically overloaded. The muscles on the left tighten and develop trigger points, while the muscles on the right may weaken from underuse. Over time, this imbalance creates persistent left-sided mid-back pain. That does not go away on its own because the structural cause behind it is never directly addressed. Number 6. Descending colon and digestive pressure. The descending colon runs down the left side of the abdomen, and when it is backed up with gas or stool, the pressure it creates can push against the left side of the body, including the lower portion of the left mid-back. This digestive-driven mid-back pain is typically dull and pressure-like rather than sharp, often changes noticeably after eating or after a bowel movement, and is frequently accompanied by bloating, a feeling of fullness, or visible distension on the left side of the abdomen. Number 7. Scoliosis or spinal curvature. Some people have a mild curvature of the thoracic spine scoliosis that places consistently uneven load on one side of the back, when the curve causes the left side of the thoracic spine to be more compressed, or the muscles on that side to work harder to keep the body upright. Persistent left-sided mid-back pain can result, especially after long periods of standing, sitting, or physical activity. This type of pain often has a gradual onset over months or years rather than appearing suddenly, and may be more noticeable at the end of a long day. How to tell which cause applies to you? Start by asking whether the pain changes with movement or position. If it clearly gets better or worse depending on how you sit, stand, twist, or breathe, the cause is muscular, joint, or rib related. If the pain stays exactly the same no matter what you do, the kidney is a more likely suspect, especially if there are any urinary symptoms. Next, check whether the pain is a precise pinpoint spot you can press on, or a broader, more diffuse ache, a pinpoint spot that catches with breathing or rotation points toward a rib or thoracic joint issue, a broader ache that responds to stretching points toward muscle strain or imbalance. Finally, consider timing. Does the pain relate to meals and bowel movements, suggesting the colon, or has it been building gradually over a long time, which could point toward postural imbalance or a mild spinal curve? Exact solutions. How to get rid of it. Fix 1. Left thoracic rotation stretch. Sit upright in a chair with your feet flat on the floor. Place your right hand on your left knee and your left hand on the back of the chair. Gently rotate your torso to the left as far as comfortable. Hold for 20 seconds, then return to center. Do 10 slow repetitions. This directly mobilizes the stiff left thoracic joints and rib attachments, releases left-sided muscle tension, and restores pain-free rotation. Do this twice daily. It is the most targeted exercise for left-sided mid-back pain and works whether the cause is muscular, joint, or rib-related. Fix 2. Thoracic extension over a chair. Sit in a chair and place both hands behind your head. Gently arch your upper and mid-back over the top of the chair's backrest, opening the front of the chest and decompressing the thoracic joints and rib attachments at the back. Focus the extension slightly toward the left thigh, leaning a little to that side as you arch back. Hold for 10 seconds. Do 10 repetitions. This decompresses the left thoracic facet joints, opens the left rib joints, and reverses the compression caused by prolonged forward bent posture at a desk or in a car. Fix 3. Left rhomboid and mid-back stretch. Stand facing a door frame and hold it with your right hand at shoulder height. Step your right foot forward and let your body sink back so your right arm is fully extended and you feel a deep stretch between the left shoulder blade and the spine. Hold for 30 to 45 seconds. Do 3 sets. This directly releases the rhomboid and mid-trapezius muscles on the left side, the muscles most commonly responsible for the nagging ache between the left shoulder blade and the spine that worsens through the day. Fix 4. Heat therapy on the left mid-back. Apply a heating pad specifically to the left side of the middle back for 15 to 20 minutes. This relaxes the muscle spasm, reduces joint inflammation, and loosens the rib attachments so they can move more freely. Apply heat before stretching for maximum effect. Warm tissue responds to stretching significantly better than cold tissue, and combining the two produces faster relief than either approach alone. Fix 5. Correct your sitting position and workstation. Check whether you consistently sit rotated or leaning to one side at your desk, in your car, or when using your phone. Even a small, consistent lean to the left overloads the left thoracic muscles for hours each day. Sit centered with even weight on both hips, your screen directly in front of you, and your keyboard or steering wheel positioned so you are not reaching or rotating to one side. This correction alone eliminates the ongoing strain that is preventing the left mid-back from healing no matter how much you stretch. Fix 6. Address digestive pressure if it is a factor. If your left mid-back pain changes after meals or bowel movements, support the descending By drinking 2 to 2.5 liters of water daily, taking a short walk after meals and reducing gas-producing foods such as beans, cabbage, and carbonated drinks. A gentle clockwise. Abdominal massage for a few minutes before bed can also help move trapped gas along and reduce the pressure pushing against the left back wall. When to see a doctor. See a doctor if the pain is constant and does not change with movement or position, if it is accompanied by fever, changes in urination, or unexplained weight loss, if it causes shortness of breath or chest tightness, or if it radiates around the left side of the ribcage into the chest. Also see a doctor if you notice a visible curve in the spine when looking in a mirror, or if the pain has been steadily worsening over many months without an obvious trigger. These signs point to causes beyond simple musculoskeletal strain that need proper medical assessment. That is every major cause of pain in the left side of the middle back, how to tell which one applies to you, and the specific steps to get rid of it. If this video helped you, hit the like button and subscribe for more back pain relief videos every week. Drop a comment below, telling me whether your pain changes when you move or stays constant, and whether it is a pinpoint spot or a broader ache. I will reply and help you identify the most likely cause in your case. I will see you in the next one.